Well, here's something for you. I didn't know this. May is Date Your Mate month, which I think is pretty cool. It's just a reminder that sometimes, especially I've been married for 16 years, that when we've been with our significant other for quite some time, you need to check in, make sure everything is going well. Andrew from South Bay Medical is joining us, and he's seen those conversations and heard those talks before about, hey, we need to improve some things.
Yes, that's exactly right. When it comes to relationships, there's a lot of things that can happen and can get in between couples, but erectile dysfunction is not one that you want. When it comes to ED, men have treated the problem with the pill for 30 years, since the early 90s, and some guys use injections. Well, South Bay Medical Clinic is treating the problem in a very different manner. One clinical study said that this is the new standard of care for ED. So it's pretty cool. It's called acoustic wave therapy. It's clinically proven to open up and regrow blood vessels in this part of the body. We've helped a lot of guys with just a few treatments get rid of the erectile dysfunction, get rid of the need to take the pill. We're finally treating the actual root cause of the problem.
So who are you seeing come into the office? Because again, I think a lot of people assume that it just happens with age, unless you want to go get those injections or just be on the pill, which I hear the side effects can be tough, that there's just not really anything you can do. It's just a normal part of life.
Right. We see every age and every kind of health condition. A lot of guys out there think, well, I'm a diabetic, so ED is just a part of life, or I've had my prostate removed. We see this, and our treatments can work. We have younger guys in their 20s and 30s. We have guys in their 80s and 90s. It has a very high success rate. If you're struggling with ED, if you're frustrated in the bedroom, we can help you. We've helped so many guys get that spontaneity back.
We know this can be a sensitive subject. How do you make people feel comfortable about picking up the phone and calling and then actually coming in? Because I know that's the first step, is to really have that consultation, hear more about how it works, see what the treatment would be like.
We hear time and time again when men come in, this wasn't as bad as I thought. I wish I would have done this a long time ago. There's a stigma around ED, and
Yeah.
men often suffer in silence. But we are making it quite easy today. We will do the consultation, the assessment, basically the approval with our doctor. Check your blood flow, all totally free. There's no obligation. We give you a little gift that produces immediate results in the bedroom for coming in as well. And we also have $300 off the treatments right now. So there's a lot of free. You can come in, see if it's a good fit. It's the first step in getting rid of the erectile dysfunction.
And again, you mentioned let's end with those trials, because the research has been done, and I think Pete, that's the first thing they want to do is know the science behind it and that it works.
There are 40 clinical studies done with our technology. What's interesting is a lot of the studies test this technology on men with severe ED or that are no longer responding to meds. The success rate's very high. It only takes a few treatments over 3 weeks, according to Cambridge University. Pretty cool stuff. The science is definitely sound.
All right, Andrew, thank you so much for your time this morning. Again, you mentioned that special offer. There's the website. There is the number to find out more as well. Good to see you, Andrew.